Tree Country 1330 WTRE. Welcome back. We've got the Decatur County Health Department and Dr. McCullough with us. I'm going to let you introduce your guest, and you're going to kind of carry the show today.
Well, I'm not really going to carry the show. I'm going to let Alicia. So today I have Alicia Nobby with me. She is here. We wanted to talk about a fun topic, West Nile virus, because that's kind of really something we all should be thinking about right now. So Alicia is our environmental health manager. Sorry, I can't get the title right. So she's one of the ones, or the main person, really kind of in charge of mosquito prevention, things like that. So I want to kind of turn things over to her, and I've got some info, and she's got info, so we'll kind of go back and forth a little bit.
Great, thank you so much. Yes, so my name's Alicia. Today actually is World Mosquito Day, if you didn't know, so it's perfect timing that we're here. So why is it even important to talk about West Nile virus? It is actually the leading virus in the United States as far as mosquito-borne diseases go, and it's established here in the United States. It's in Indiana, so it's important that we're here today to talk about it. July through October is usually when we see these mosquitoes that carry that virus. So it's perfect timing today.
What a National Mosquito Day. That's really like...
What a thing to celebrate.
What a thing to celebrate, that's right. What have we seen throughout the county this year as far as the prevalence of mosquitoes, West Nile?
So the Indiana Department of Health has done their own samples of mosquitoes to test for West Nile virus. They haven't found any yet, but that doesn't mean it's not here. We've also sent in our own sample to the Indiana Department of Health. We're hoping to get those results this week or next week, just to see if we found any mosquitoes with the virus, but we haven't found any yet.
But Ripley County, I'm trying to think, when was that in the paper?
That
maybe
was,
a week or two?
Either last week or earlier this week, yeah.
So that they identified it in their county, and we touch their county.
It's
so
in the area.
There's zero reason to think it's not here. So
if you're a parent or an animal owner and you're thinking, the possibilities there, what are some of those signs that we should be looking for, especially in our kiddos?
Of the actual disease itself.
Yeah.
It's kind of a little hard to say how many people actually come down with West Nile virus, because about 80% of people are asymptomatic or very minimally symptomatic, because it could just be headache and muscle aches, some swollen glands, just like any kind of mild virus could happen. And we're not testing all those people because they don't all want to come in and get a blood test. So it's hard to know how many people actually totally get infected. But they really think that 80% of people never know that they have it, that they're so asymptomatic. And they kind of figured that out because they started checking for that in blood donations, that people would come in totally asymptomatic, and poof, once they developed a test for, and I think it was like 2002, they started checking for it. So number one, a lot of people don't ever get symptomatic and yet may have had it, and you can't pass it from person to person. It's only passed by mosquitoes. Only 1% of people infected will get severe illness, but it's encephalitis, meningitis, inflammation of the lining over the brain or the brain itself, and they get high fevers, bad headache, nausea, diarrhea, vomiting can all happen, muscle aches, tremors. So a severe case, I really think parents are not going to miss it. So, and they would seek medical help. But I have to tell you that we don't really have a way to treat it. It's a virus, so we don't have an antiviral that's effective against that. It's all supportive. So we're doing IV fluids, pain medicines, because the headache can be severe. If they get bad enough, the oxygen, they wind up on a vent, tube feedings because they stop eating. Sometimes you can use steroids. I know I've only had one case that I ever treated, and it scared me to death because Riley did not want the patient to come up to Riley because there really wasn't anything. In our case, was not severe, thank goodness, but she was in the hospital, I'm trying to remember, and it was a kiddo. So I've only seen it actually once, but it made a big impression on me, and not everybody recovers. Unfortunately, some people can have lifelong disability, or even die. So
not something you're going to forget if you go through that.
Yeah.
as far as the county, how do you kind of survey for that, and then providing education, and especially mosquitoes like wet, and they like to be around things. So how do we prevent this in the county?
Yeah, so as far as how we're monitoring, we set up traps. We set up what's called a gravid trap, and that is specifically designed for egg-laying mosquitoes, and specifically the Culex mosquito, which is the one that carries West Nile virus. So we set one trap up out kind of by the fairgrounds, where it's nice and shady. There's not going to be a lot of wind, because they don't like wind either. And we collected a few of those mosquitoes, sent them up to the lab, and the lab does the same thing. They actually set traps up in town as well, throughout the county, and they'll test also. So as far as education, this is kind of the first year that we're doing our kind of vector control program. We're trying to get it back out there again. So as far as prevention, I developed an acronym I think is really cute. It's called SWAT. So it means spray, an EPA registered repellent, so something like DEET, picaridin, IR3535, or oil of lemon eucalyptus, and you can find those at your big box stores. W is to wear long sleeves and pants to prevent the mosquito from biting you. A is to avoid the hours that they're most active. So the Culex mosquito, which is our West Nile vector, that's going to be most active during dusk and dawn hours. So when we're having our barbecues or when we're at a baseball game.
We're all out there.
Yep.
Prime time.
It's hard to avoid those hours, but if you don't need to be out there, maybe stay inside. And then T is for tip and toss any standing water, because first of all, they really like stagnant, dirty water, and they need that water to lay eggs. So if we just get rid of their breeding habitat, we're going to reduce the population.
Is there I'm going to call it a season, but is there like a prime time for mosquitoes? Like, after August, September, do we see them start to go away?
So late summer to early fall is when we're going to see them most active, and then after that they kind of go away. They don't really like colder temperatures. They prefer anything above about 60, 65 degrees.
Okay, so if people have questions about West Nile, where do you direct them?
They can come to us at the health department, and if they have any questions, they can also visit the Indiana Department of Health mosquito dashboard. If you just go to Google, you can type that in your search engine, and that brings up a ton of information about different mosquitoes in the area, as well as different diseases. There's information about West Nile, and you can also stay on track about whether or not they've located any of the virus in the county.
Okay, so
what was that again?
The Indiana Department of Health mosquito dashboard.
Okay.
a little wordy.
Who knew they had that? So yeah.
Now, so Ripley County is the closest to us right now that has been positive.
I believe so.
Okay.
I think I read that we know that 15 counties have been identified, and that I don't know how old that data is. So it's all, whether you got the right mosquito that you're checking, potentially you just don't know because it's spread. Mosquitoes get the infected bird, they're going to get it from the infected bird, which they can then pass it to another bird or maybe fly to another county. I don't know how far mosquitoes go, but the birds go a long distance. So that's how it spreads.
It's really hard to tell the actual amount because of you're testing a sample, so it's
yeah.
Very small sample. And they don't fly very far. They might fly.
Good to know.
They might fly a mile, if that. So if you're finding mosquitoes, there's a good chance they're in your backyard. So you've probably got a good mosquito breeding ground hiding somewhere in your yard.
Is their lifespan very long? Do we know? I don't know. Because a fly's not very long, right?
No.
That just occurred to me.
I think they breed pretty quick.
We'll do a quick search.
Yeah. I was cleaning up my backyard area and was very embarrassed. I mean, on multiple spots, I had standing water in little containers, so it was kind of like, oh, wow.
Well, we've had such sporadic spurts of water this summer. I think we probably all get in that position because we get that big dump of rain and it fills something up and it sits there.
Well, and one of the things I was reading was gutters. I would never think to go check my gutters, but there can be standing water. Okay, so this is interesting according to Google. Males typically live for 10 to 14 days, and then females can live for several weeks to months.
Oh, they have a long lifespan.
Wow.
Yeah, and they will lay hundreds of eggs at a time, so definitely want to keep those
a little nuisance to society.
Yes. And some of them are just a nuisance. Some of them don't pass any disease, but it's good to still keep them away from your yard.
You know, we've also seen this summer a lot of the hoverflies, I think are what people are calling
gosh.
them. Is there any danger? Do they carry anything? Are we just monitoring those?
As far as I know, we're not.
I'm not aware of
monitoring.
anything. They're just extremely annoying,
They are,
and I like
yes.
to call them sweat bees. That just sounds so much nicer than a hoverfly. I didn't even know it was called that till recently. It's like,
Yes.
oh,
I learned that term a couple of weeks ago, too, and I was like, oh, well, yes, they are hovering and they are annoying. So
They are very annoying.
yeah.
Now, you played a pretty instrumental part with the community garden this
Yes.
year. Tell us
Yeah.
about that. Has been widely successful.
Yes, I'm loving it. So actually, our intern Esther Parr, it was kind of her idea to put this garden together. She's not with us anymore. She's gone off to college, but we still wanted to keep it rolling. So the health department partnered up with Decatur County Recycling, the Purdue Extension Office, Soil and Water Conservation, and the Greensburg Public Library. And we all worked together to put the garden together. It's done really well. We just had our ribbon cutting ceremony last week. That was exciting.
Yeah, a lot of turnout.
Yeah,
so
we had a
it's
really
nice,
good turnout.
even though it was incredibly hot.
It was very hot. We've harvested close to 400 pounds of produce since June,
Oh, wow.
all free to the community. So if you ever need any produce, feel free to come by the garden. We've got it.
What are some of the things that you guys have grown in the garden this year?
The biggest thing is probably cucumbers. We've ton of cucumbers. Zucchini is another really popular one. We've grown some yellow squash. I don't know if we'll do that next year. It's not been, people aren't really taking advantage of it that much. I don't know if maybe people just don't really cook
They may
with
not
it.
know how to
Yeah.
cook with it. It can be done. It just looks kind of weird
It
to them
does.
if they've not done that
Yeah.
before.
I know Sabrina was in with Purdue Extension, and she was saying you could do zucchini and the yellow squash very similarly.
Yeah,
Mhm,
yeah.
yeah.
Someone actually at work made yellow squash bread and brought it in, just like
okay.
zucchini bread. It was really good. Yeah.
Very nice.
hmm
And then you were talking the pathways have been poured out
Yes.
in the garden.
hmm
So that'll just allows easier access?
Yeah. So the Community Foundation gave us a grant that allowed us to fund pavement for our raised beds, specifically the handicapped accessible beds. So now if you're in a walker, if you're in a wheelchair, you can more easily walk or roll up to those beds to help harvest or plant or weed.
Very cool.
Yeah.
I think it's been great for the entire community. It's got everybody out, and if you live in an apartment or don't have the room for a garden, this gives you the chance to get
Yes.
out there.
Well, and I think the garden's always looking for more volunteers if they'd
Oh,
want to
weeders,
come
right.
out to come out and weed. It's just been so hot this summer. It's kind of been hard to
Yeah.
get people out at the times that we were kind of suggesting, just because it was so incredibly hot. But it's cooling off.
And,
so
we've had
hopefully,
prime weed growing weather with
Yes.
the rain and the heat. So
A ton. We spent the 2 days before the ribbon cutting ceremony, we spent about 4 hours outside pulling weeds. It was exhausting, but we did it.
just weeding, right?
Just weeding.
Very good. That's been a great asset to the community. Look forward to it next year.
Oh yeah, next year we want to expand. We want to add more.
Very good.
Yeah.
You guys had your back to school bash since you were in last. I heard that was very successful.
yeah, I was not there, but I know. Do you have any of the data on how many numbers? I'm trying to think how many they had, but it was larger than last
I
year.
want to say
it
over
was
600 people
yeah.
showed up.
Wow.
Yeah,
So I
much.
gave almost 400 backpacks, I think, away that was ready with school supplies for kids. They had immunizations, sports physicals, just a lot of vendors. I don't know if you remember who all was there.
Oh,
Yeah.
there were so many. I
Yeah.
wouldn't be able to tell
So-
you. We had a big touch a truck event there too for kids to just kind of get involved with all of those.
Haircuts. I
Yep.
think they did the haircuts again, which is very popular with kids. Several of the local hairdressers came out and donated their time to do haircuts for kids. So
Had people ready to go, ready to go back to school.
that's right.
Hard to believe we are back in week 3 already.
It's time.
It is. What else has been going on at the Department of Health?
I would put in a plug for our Walk for a Doc. I'm trying to get our numbers up. Basically, we do that every Wednesday, 5:15. We meet at the library in the meeting room right there, and then we walk at Rebecca Park. And just trying to get people to think about exercise. This is a simple way to do it. But getting together with people, there's a very short, I promise, very short health talk, although I'll probably talk about, West Nile virus today. But then we go out for a walk, and we've been able to get some people. I mean, we're obviously, there's a lot of people out there that already walk very actively. So this is kind of really for people that might want to join and help others walk, trying to get them motivated to get out and just start doing some walking. I have a sister-in-law that has been coming, and she walks very slowly, but she's there every week and walks, and each week she goes a little farther. So it's really kind of geared for the person that maybe doesn't normally do anything, and because we know exercise is so important. So.
Gives you a little camaraderie too, to be able to walk with a group of people, and you're not just out there by yourself, trucking along. And that'll be tonight. It's on Wednesdays.
Yes, every Wednesday, 5:15. Takes us about an hour altogether to wrap up. So.
And that's at the library.
At the library, yeah. We meet inside the library initially in the meeting room. So.
Very good. Great programs.
Yeah.
Immunization, school is back in session.
Yes.
So immunizations are still offered?
Yes, yeah. So our regular schedule, just calling the Board of Health and they can get you in. So.
We also have the not free clinic, the walk-in clinic from 10 to 6 on Wednesdays.
Yeah. Okay, so just if you need an immunization, you can come in and get whatever that is.
Yep.
All right. Any new and upcoming things?
I don't think we have any programs really upcoming at this particular time. Just kind of focusing on continuing what we've been doing.
Well, good.
Yeah.
Very good. Any other thoughts before we wrap up today?
I realized I had a little more data that I wanted to pass on West Nile virus, that there are groups that are more vulnerable. So it's something to kind of think about if you're in this group, because I am. Anybody over age 50, you are more likely, and if you are 65 or older, you are 3 times as likely to get severe disease from West Nile virus. Really? So, yeah, I didn't realize that. So, anybody with a weakened immune system, so if you've had an organ transplant, but more and more people are on immunosuppressive drugs, and they probably should have been told that when they first got on it, but for some skin conditions, just a lot of different things, they may be mildly immunosuppressed, but that can make a big difference if you get bit by the wrong mosquito. If you have certain medical diseases, so this again applied to me, anybody with diabetes, cancer, hypertension, or chronic kidney disease are not, they just are more prone to getting severe disease from the bite. So, and then, of course, anybody who's outside a lot of times, outdoors a lot for work or just recreation, because, what are we all doing right now? Camping, and so that hits that evening hours that we need to hit that protection. And then I was kind of reading that it talked about, covering the skin and protecting, keep your screens mended. But you can actually get mosquito netting, which other areas of the world use quite a bit. But I had never thought about this, but I Googled it, and you can get mosquito netting covers for your stroller. And baby carriers. So I have never thought of that before, but I think I'm going to order some for grandkids. So, yeah.
The more protection, the better.
Right. So
absolutely.
So
be on the lookout for mosquitoes.
Yes.
That's our
it.
wise word today. And SWAT.
Avoid them. SWAT. Yeah, I love that.
Give us your acronym again.
Yeah, SWAT is to spray an EPA registered repellent, wear long sleeves and pants, avoid dusk and dawn hours, and tip and toss any standing water.
I love it.
It's good.
It goes right along with
it.
It does.
Yes. Very good. Ladies, thanks for being in with us
right,
this morning. We love our
much.
monthly visits and get to catch up with what's going on down at the Board of Health. So,
all right. Thank you. Thanks for having us.
It's 8:54 on Tree Country, 1330.